Hello everyone, welcome back to my channel. Today we'll be starting off with a new series, the anatomy of the abdomen, and in this video I'll be introducing the anatomy of the abdomen and I'll be giving you 25 most know easy like questions of the anatomy of the abdomen that should be your guide as you watch through the series or as you read the anatomy of the abdomen in any of the recommended textbooks. So stay back as we dive into this topic in details with interesting and high-yield mnemonics. So the abdomen is the lower part of the trunk below the diaphragm. Its wall surrounds a large cavity called the abdominal cavity. The abdominal cavity is much more extensive than what it appears from the outside. It extends upward deep to the costal margin up to the diaphragm and down within the bony pelvis. And for the abdominal cavity is divided or subdivided by the plane of the pelvic inlet into a larger upper part called the abdominal cavity proper and a smaller lower part called the pelvic cavity. Now from this diagram we can see the diaphragm, the thoracic cage, the costal margin, the tenth rib, the abdominal cavity proper, the pelvic inlet that divides it, the pelvic, the pelvic diaphragm, perineum. Now, these are the high-yield, must-know easy like questions that should be your guide as you read through, you watch through this series. Number one, give an account of the gross and developmental anatomy of the stomach. Number two, give an account of the gross and developmental anatomy of the duodenum. 3. Describe the gross and the developmental anatomy of the pancreas. 4. Give an account of the portal vein and the photosystemic anastomosis. 5. Give an account of gross and microscopic anatomy of the spleen. 6. Describe the anatomy of the kidney and the anomalies that may be associated with its development. 7. Give an account of the lesser sac of the peritoneum. Add a note on its development. 8. Describe the gross and the microscopic anatomy of the ramiform appendix. 9. Describe the anatomy of the suprarenal gland and add a note on its microscopic anatomy. 10. Describe the extrahepatic diuresis apparatus. Add a note on the histology of the gallbladder. 11. Give an account of the gross anatomy of the liver. 12. Describe the gross anatomy of the inguinal canal. Compare and contrast the anatomy of direct and indirect inguinal hernia. 13. Give an account of the gross anatomy of the diaphragm. What developmental anomaly occur in this organ? 14. Write short note on the peritoneal reflection on the anterior abdominal wall. 15. Write short note on the blood vessels of the kidney. 16. Write short note on the lymphatic drainage of the stomach. 17. Write short note on the microscopic anatomy of the pancreas. 18. Write short note on the microscopic anatomy of the liver. 19. Write short note on the microscopic anatomy of the intestinal villi. 20. Write short note on the development of the midgut. 21. Write short note on the development of the pancreas. 22. Write short note on the ligamentous arteriosus. 23. Write short notes on omental bursa. 24. Write short note on microscopic anatomy of the intestinal villi. 25. Write short note on the femoral sheath. These are high-yield, must-know, easy like questions that must be at the back of your mind as you watch through this series or as you read any of your anatomy textbook involving the anatomy of the abdomen. As we progress, I'll be giving you interesting mnemonics that will help you master this easy like question and reproduce it without thinking much in exams. If you want to see more interesting videos, subscribe to this channel, like, turn on the notification bell to know when I drop new content. Thank you so much for watching.